Welcome to the University of Cincinnati Internal Medicine Residency Patient-Centered Rounds tutorial entitled Presenting Labs at the Bedside. After this presentation, medical teams should be able to identify which labs are appropriate to present at bedside, engage the patient when reviewing the labs, and assess resident communication skills by observing discussion of labs with patients. In this first vignette, see if you can identify the problems and opportunities for improvement.
Dr. Orange, I wonder if you could tell us a little about Mr. Chen's labs.
Sure. So sodium 144, potassium 3.4, chloride 110, bicarb 20, BUN 27, creatinine 1.4, glucose was 135. Whites 5.7 with 78% newts. H&H 10.3 and 31.5, platelets 130, the MCV was 102.1, LFTs AST 50, ALT 37, total Billy 1.2, direct 0.
Did you get an LDH?
I'm not sure. I didn't write it down.
Okay.
I don't know.
She should have got that.
But the albumin was 2.1, alkphos 87, and lipase was 3,900.
Wow.
Yeah.
How about the CAT scan? What did that show?
It kind of an inflamed pancreas with some fat stranding and a pseudocyst.
Wait, what are we going to do? We'll get to that.
In this initial example, the resident physician recreated the usual lab recitation from traditional table rounds. This is not appropriate at the bedside. Teams need to decide which information is the most appropriate to discuss and explain to the patient. Attending physicians can help this process by reviewing data before entering the patient room. In this next example, pay special attention to the way the team identifies which labs are appropriate to present at bedside, engages the patient when reviewing the labs, and assesses communication skills by observing resident discussion of labs with the patient.
Mr. Chen, as you know, you've had a lot of tests since you've been here, and so we're going to try to explain a little bit about those to you. So I'm going to ask Dr. Orange to kind of go over all that with us.
Okay, so I'm just going to point out the things that I think are important for you.
Okay.
Looking at your electrolytes, your potassium was a little on the low side at 3.4, and we replaced that in your IV fluids. Also, BUN was 25 and creatinine 1.4. That's a measure of your kidney function, and it tells us that you were dehydrated. And like I said, we've given you the IV fluids.
Probably because I was vomiting so much.
Exactly.
Okay.
Other things I wanted to talk about was on your blood counts, your red blood cells are on the lower side. So have you heard of the term anemia?
Yeah.
Okay.
What was that number exactly, just so I know?
10.3 and 31.5.
Got it. Did it change overnight since he was admitted?
It dropped a little bit with the fluids, but I think that's to be expected once he got some fluids in him.
That's fine.
Okay.
And then the lipase, which is a number that we use to measure if your pancreas is inflamed, was high. It was 3,900, and that's high for you in the past.
So is that bad?
It just helps us understand that your belly pain is probably coming from your pancreas.
Okay.
And we'll follow that number over time, and as it goes down, we'll know you're getting better.
Okay.
Did you get an LDH?
Oh, I did. I didn't write it down.
I think I can look it up. It was 45, which is fine.
Great, thank you.
Mm-hmm.
That's good.
Okay.
CT scan.
Okay. Also, we got a CAT scan
Uh-huh.
of your belly, and we can bring it up right now and kind of show you what we
Right
saw.
here.
Oh, good, because nobody showed me before, so.
Okay. So, sir, this is the picture of your belly,
Uh-huh.
and this right here is where we're worried about your pancreas and how it's a little bit, we're concerned for a little bit of inflammation and swelling right there.
Okay.
Okay.
That's really neat. Not for me, though.
So that's the test we have gotten already, and we're going to follow along the same test to see, make sure you're getting better. Do you have any questions about that?
No, I think you answered them.
When conducting bedside interprofessional rounds, successful teams identify which labs are appropriate to present at bedside, engage the patient when reviewing the labs, and assess resident communication skills by observing discussion of labs with patients. We hope you have learned something from our presentation on presenting labs at the bedside. Please visit our other video tutorials using the search word UCINTMED.